to the Minnesota PRT. I think we still have some folks coming in from the waiting room and probably some folks still joining us. But since in the interest of time, we're going to go ahead and get started right on time. Thank you all for being here. Thank you for being on time. I'm Liz Flannery. I use she, her pronouns. I'm the Director of Education and Leadership here at AIDPH, or the American Institute on Disparities in Public Health. And we're really thrilled to be here talking with you all today about veteran oral health and specifically veteran oral health and what that looks like in your state. So we're going to go ahead and get started. Our agenda today, I'm going to give us an introduction. I'm going to go through some housekeeping and then I'll start with a national overview of what veteran oral health looks like before we dive into your state specific data. We will have a lot of discussion throughout different ways to engage. We want this to be an interactive session. We want you to have space to connect with your colleagues. So we're going to invite you to do that in the chat. We want to hear what work you're doing on veteran oral health, and again, have time for you to share that with your colleagues in your state, and also have feedback on the data that we're sharing. And we will do that in several different ways. Just giving you a heads up, we hope you're ready to be active and engaged through this session. And we will leave with some action items and next steps, both in regards to CEU logistics and how you can stay activated on this topic in your state. We are recording this session. We would love for you to come on camera and be together in community as we have discussion. Please stay muted until we are having discussion and you're adding during those discussion periods. We welcome you to come off mute and have discussion. Slides, any resources folks share, the recording, all of those materials will be posted to our academy, which we will give you instructions on how to access at the end, and Shayla will email out as well. Please take a moment to say hello. Again, getting started with connecting with your colleagues. We would love for you to share your name, if you want to share your contact information, your organization in the chat to say hello to each other. And if you have any questions along the way, you can post those in the chat as well. If you're having any Zoom issues, Shayla Stewart, my colleague from AIDPH, is here. She can go ahead and help you. So to get us started on one of the ways that we are going to engage today, we are going to use slido.com. If you have not used that before, this is a very simple, easy to use engagement platform that lets us do some polling and some word clouds and some sharing out. You can access that by scanning the QR code here. You can, or you can go to slido.com and enter in this code, and Shayla is going to post the link in the chat as well. We'll leave that for 1 second, but again, if you're not able to grab it or folks are coming in from the waiting room, we will have this information in the chat. Okay. These are our learning objectives that are tied to our CEUs for today. They are also available on the Academy for what we're going to cover. And we're going to go ahead and get started with that engagement. So if you did not already scan that QR code or go to slido.com, go ahead and do that. Grab the link in the chat. And we'll get warmed up using Slido by toggling over to that and answering the poll, what brought you to today's session? Okay, great. Folks are already there. I see that many folks want to learn. Many folks want to learn, share, connect, and act, all of the above. Okay, give folks a minute. Okay, all of the above is getting close to the learning. And we'll do a check-in at the end too and see if you feel like you've accomplished these pieces or if you feel ready to go out and do more of these pieces, specifically the acting. And this just helps us see where we're all coming from together as a group, and also can help guide me as we go through our work here today. Okay, I'm going to go ahead and go back to our slides, but this will stay open for a moment. So if you have not yet answered, please go ahead and do so. Okay, this is again just part of our CEU information. I am your main presenter for today, and I do not have any disclosures to share. Again, host, I'm here. I'm Liz Flannery, for those who might have been in the waiting room when I did an initial introduction. I'm the Director of Education and Leadership here at AIDPH. I'm joined by my colleague, Shayla Stewart. She'll be helping us along the way with our polling, can answer questions in the chat, etc. And we want to say a big thank you to Nancy Wilson, who's here with us today, for helping us coordinate and sharing out this information with all of you. Your state has been really activated on this and really engaged with getting the word out. So thank you so much for your support and your work and for being with us here today, Nancy.
Well, and thank you for including Minnesota in the roadshow and all the hard work that you guys have put together. So we really appreciate it.
Thank you. Okay. Before we really dive into our data, we've gotten through our housekeeping pieces. We're going to start with another poll, and that is, what do you believe are the top priority areas for veteran oral health in your state? Okay, I'm gonna toggle over, and I know that there are folks just coming in from the waiting room, Sheila. So if we can pop that Slido link one more time so folks can get it, that would be wonderful. So if you're just joining us from the waiting room, we are using Slido today as one of our main engagement tools as we connect with conversation together here today. So you can access that by the link Shayla's putting in the chat. You can scan the QR code on the screen here, or you can enter in this in your web browser with this code and access our polling. We'll be using it throughout the seminar today. Okay. So folks are answering, what do you believe are the top priority areas for veteran oral health in your state? And I think we're clearly at 100% of access to care. I will share that we have been well over half of the country at this point with this seminar in states, and access to care is always the first thing that pops up. And if not 100%, is always the winner on this piece. So we are finding that across the country is the priority area. Okay. That's helpful as we dive in. We're going to go back to our slides. If you haven't answered, please go ahead and do so. That poll will stay open for a moment. Okay. So a little bit of an introduction about who we are as an organization and why we do this work and why we're here talking to you about this issue today. So at AIDPH, our mission, we are a small 501c3 nonprofit, and our mission is to empower our community to eliminate health disparities through research, education, and advocacy. And you really see those three pieces coming together in this seminar here today. We're taking our research on the disparities that veterans face in states. We are pulling that out into an education program here today, and we're talking about how you can use those tools for education in your community and to advocate around this issue. We do this work because we have a vision of an accessible, affordable, and valuable public health system. So thank you for being a part of that work and being with us here today. We do our work again through research, education, and advocacy, and we do that in a few specific communities, health issue areas, and work areas. And those are lifespan wellness, queer health and well-being, rural communities. You will see that come up a lot today with a talk on veterans. Veterans disproportionately live in rural communities, and we know that that compounds the disparities they face in accessing care. People with disabilities, public health workforce, veterans and active duty service members. Obviously, that is our main focus here today, and care delivery models. Those are our focus areas. And when we're talking about our communities of focus, we really see that there's, of course, intersectionality. For example, approximately 30% of veterans report having a disability, and approximately 25% of veterans live in a rural area. I just spoke to that. And again, we will talk about that more, looking at the data and the tools we have around. Okay. We want to say thank you to CareQuest Oral Health, who is our funder for this programming and has enabled us not only to do the research and produce these state profiles, but to be going across the country and taking this virtual road tour state to state to really talk with folks at the local level and share these tools out. And again, a little bit more about that partnership and why AIDPH, why us, why we're here doing this talk. We've really focused and specialized in veteran oral health for several years now. It really started with an understanding and a conversation between AIDPH and CareQuest that there was not research out there. There was not information and strong data out there on what veteran oral health looked like. We identified that data gap and started the research process in a community engaged manner, starting with surveys and going from there all the way up to now and going into 2026. Nancy, we were just having a conversation with Nancy about Open Hill Day that we're headed into in the next few weeks. We have been the community champion for veteran oral health on Open Hill Day for the past several years. We've done several other Hill Day events outside of that as well around veteran oral health and are really just honored to be able to take the research and the work out into the communities and the tools for folks to be able to activate around the disparities we have found in our research. Okay, so really diving into the data here, as I said at the top of this call, we're going to start with looking at a national overview before we dive into the state specific data to really kind of understand what it looks like across the country and then get a little bit granular from there. So this might be familiar to some of you, but what we've found from doing this work for many years now is that sometimes folks, many people, sometimes even veterans themselves, aren't really fully aware of how VA medical and dental benefits actually work. So we like to begin by setting the stage with a clear picture of what's currently available through the VA and what veteran oral health looks like at the national level. So one key point to take away from here is that eligibility for medical and dental care through the VA isn't set by the VA itself. It's determined by Congress through a federal law called Title 38. And that law outlines what care is covered, who qualifies, and how much it costs, where it can be delivered, etc. Because of that, any major change, like expanding dental coverage, requires congressional action. It's not just a policy update, it involves passing new legislation and then securing the federal funding to support that legislation. So when we're talking limitations in access to dental care for veterans through the VA, it all ties back to laws at the federal level. Um, at the same time, I want to point out that that doesn't mean we can't take action and impact change at the local and state level. The first piece to that happening is getting educated, like we're doing here today, and collaborating with our local communities for innovative ideas. And we're going to give some examples of those. Okay. So, the next major point here is that currently most veterans are not eligible for dental care through the VA. Dental care eligibility is separate from medical eligibility. So, if you're eligible for medical care through the VA, that does not automatically mean you are eligible for dental care. So, this is a graphic that represents what we're looking at here numerically. This row of people you see represents all 18 million veterans living in the US today. The lighter colored half over to the right shows veterans who either receive care outside of the VA or aren't eligible for VA healthcare at all. As you move to the left on the chart, that darker blue section represents the nearly 9 million veterans enrolled in VA healthcare. But of those, as you move even farther to the left of this graphic here, only a tiny fraction, that small blue and red segment, is actually eligible for dental care through the VA. And what that means in practice is that some veterans may be going to the VA for medical appointment or treatment for chronic condition, but they're leaving still dealing with untreated dental pain and dental issues because they aren't eligible for that dental care. Another piece here is that even among the about 1.8 million veterans who are eligible for dental benefits, only about a third of them are actually using those benefits. We need more data and information looking into that low utilization rate, but anecdotally, we understand that barriers to care and lack of awareness play a big role there. So we're left with a deeply inequitable system. Veterans either aren't eligible at all, or they face a fragmented oral health landscape that makes it hard to get consistent, high quality care. And we know that this can be even worse for veterans living with chronic conditions, where good oral health is very critical. We're going to look at that a little bit more here. So veterans living with chronic conditions like heart disease and diabetes are especially vulnerable to oral health issues. I'm just going to take a quick sip of water. And what's even more concerning when we're looking at the data here is that veterans with these high risk, high cost conditions are more likely to lose all of their permanent teeth. And we see poor oral health outcomes for veterans and non-veterans, even when they've seen a dentist in the past year. So access alone isn't solving the problem. Even when veterans are getting the dental care, many are still facing some of the worst oral health outcomes. And the reason for this is the lack of the integrated care. These chronic conditions aren't being addressed in coordination with oral health needs. And that's especially frustrating because the VA is the largest integrated healthcare system in the country. It is uniquely positioned to manage complex care for veterans with multiple chronic conditions. But since most veterans aren't eligible for dental care through the VA, they're missing out on that critical coordinated care piece, which leaves major gaps in their overall health outcomes. So, we're going to dive into this a little bit more here into specific chronic disease. So this comes from research that we conducted again in partnership with CareQuest that really focused on the connection between chronic disease and oral health. So even after controlling for factors like income, education, and whether someone lives in a rural area, we found that veterans with diabetes are still 40% more likely to be edentulous, meaning that they have lost all of their natural teeth, compared to veterans without diabetes. And that's a really powerful indicator of just how strongly chronic disease can impact oral health outcomes, even when other risk factors are taken into account. So, just as concerning are the findings that we see related to heart disease. Veterans with heart disease were 30% more likely to be completely edentulous compared to veterans without heart disease. Again, reinforcing what we're seeing across the board there is that chronic conditions like heart disease and diabetes have a significant impact on oral health outcomes for veterans, even beyond other contributing factors. So, what we really want to highlight here is that this isn't just about poor oral health outcomes or reduced quality of life. Those are serious concerns, obviously, but it's also about the broader health impact and the cost of care. So, when dental care is managed as part of an integrated healthcare system, like what the VA could offer if dental coverage were expanded, there's a clear opportunity for cost savings, especially for veterans with chronic conditions. Some of our recent research shows that for every $1 invested in dental care as part of diabetes management, there's a $1 savings in related medical costs. And with heart disease, it's even more striking. Every $1 spent on preventative oral health care can result in $2 saved in heart disease management. So at that point, healthcare, dental care isn't just a health benefit, it's paying for itself. And I just want to set this context to keep in mind as we look at chronic disease trends in your state and consider what solutions might look like there as you think about your system and your ecosystem of healthcare as we dive into your data. Okay. Um, Again, looking at the rural veteran piece, these are some data points through research that we conducted with CareQuest. The data came from Bufus, which, as many of you may know, a national survey of a national surveillance system survey. We also pulled data from a national survey of veterans administered in 2021, and as well as data accessed through the VA. So really just kind of looking broadly at what access to care looks like for rural veterans. Okay. We also always strive to raise our community voice. We pull qualitative data into our quantitative data as well with mixed method research, and we just pull this out here to really give that human side of all of those numbers that we just looked at. This quote is from a working age veteran who was in Maryland, who just is still unable to afford care, and we can see that they're asking for help. They don't qualify, they need help, they don't have a pathway. And I think it's just really striking to show that human impact and what our veterans are asking for and needing behind that data. Okay. So we are going to talk about when we move into your state data, we are going to talk about the resources available and what we can do with that data. Um, those live on a website that Shayla can pop in the chat. It's vetdentaldata.org. And the state profiles live there, but it's a full compendium and tool set of resources available. So we just want to point out some other things that you can do beyond the state profiles with the data on veteran oral health that is available on that website. So we, of course, have all of our research published, but we have several interactive dashboards as well. And we talked a lot about veterans because we understand that veterans disproportionately live in rural areas, and that makes access even harder. We talked about that low utilization rate. If veterans are living in a rural area, and even if they are eligible, they might not be having easy access to that VA dental care. So we have a dedicated tab to rural veterans. And we're just kind of showing you here, you can click on this and it's again an interactive dashboard, noting that this was pulled from MEX, which is the Medical Expenditure Panel Survey. The data there isn't available on the state level, but they can be evaluated by region. So you get a sort of state proxy there with this data dashboard that's available. And I'm just sharing some screenshots here of kind of what you can do and what you can click through in these interactive sessions. So if you click on the rural tab, it will take you to an interactive dashboard. And then across each indicator, it's clear to see that rural veterans delay dental care due to cost, spend more out of pocket on dental care, and struggle to find accessible locations for dental care. Okay. We also see, again, screenshots of what you can do with the dashboards here. Rural veterans also feel more impact from lack of access and utilization of dental care, often citing that the state of their mouth or teeth is embarrassing compared to non-rural veterans. And rural veterans also struggle more with a functional dentition, which likely leads to the data points we see around increased cost of care and higher emergency department use. All of our research is available on vetdentaldata.org as well. We always strive for all of our research to be open source and available in translational tools that people working on these issues can access and leverage in their work. So this is again just some screenshots of the available information. There's several different interactive dashboards, many research reports, and now we're going to dive into the state profiles and what that looks like for your state and how we can leverage that tool. Okay, so as we get ready to head into your state, we would love for you to toggle back over to Slido. And please share in one word, naming what you think your state's biggest challenge is for veteran oral health. So again, the information is in the chat, or you can scan the QR code here, pull that up, and we'll see where we're all at before we dive into the data.
Did you say just one word? Okay.
I'm seeing some reflections from our earlier poll, money, staffing, access, coverage, all of those pieces tie into access, transportation, limitations on eligibility for Medicaid coverage. As you can imagine, holding these calls and also doing seminars on rural oral health, transportation comes up a lot in the work that I do. And what I always try to raise, and what I think is particularly important about transportation when we're talking about rural communities, is a transportation issue is always an issue, and it is always different state to state based on what their geography is, what their weather patterns are. So sometimes it's that folks can't afford snow tires. They might have their own transportation, but half of the year they need snow tires and they can't afford that. So half of the year is off the board for them. In other areas, it's more of a public transportation issue. So if you have specific thoughts or questions or issues you're coming up in your work, it would be happy for you to share that in chat with your colleagues. Okay. I'm going to toggle back to our slides. If you have not had a chance to answer, please go ahead and do so. We'll leave that live for you for a few minutes. Okay. So, really getting into what we're here for. What do these oral health profiles look like for Minnesota? We put these state profiles together to answer a simple but frequent question we were getting doing this work. And having done it at the national level, we were hearing over and over, what does veteran oral health look like in my state? And that is why we approached these profiles. We're going to again, Shayla put vetdentaldata.org. If you have not already done so, please feel free to pull up your state profile, follow along. You can go to publications, pop your state in there, pop Minnesota in, and pull up your profile. Um, Okay. And again, this seminar series that we do is just as much about listening and learning from you. You know your state best, you know your data, your context, your communities. So your insights really help us improve these profiles, make sure the tools we're providing are actually useful to your community. So please put things in the chat. Let us know what you're thinking. Let us know what questions you have. We've done our best with the data available, and while it's limited, as we all know, when we're looking at publicly available national data sets, the data can be limited, but these profiles really aim to offer clear, visual, easy to use information that can support conversations and decisions across different audiences. I'm also sharing that these are about 3 years old, and we are currently updating. Our research team is redoing the analyses with the most current data and adding in some additional data on aging veterans. So these will be getting a refresh. They are still very usable, still really relevant, and they will be fully up to date after this summer. So keep an eye out for that as well. Okay. So if you have pulled up your profile, that's great. If you haven't, that's okay too. We have the screenshots here, and we're going to start at the top of the profile. We open each profile with some quick context, what's happening in Minnesota and how it fits into the bigger picture nationally, especially when it comes to dental care access through the VA. So just like we did on this call, we think that it's really important to start with the key point that most veterans are not eligible for dental care through the VA. Again, it's something that we find that many people, especially policymakers and funders, don't realize, and it can be a really powerful way to start the conversation with those decision makers. Um, and because of the gap at that federal level, it's states and local healthcare systems that end up carrying the weight. Whether it's disease burden, access issues, or care delivery challenges, it's really falling to the states. So that's an important piece. We've also included data on where veterans live across Minnesota, especially counties in high concentrations. And we pulled in whatever we could find in rural veterans. So right up front, we hope you give this a useful county level insight to support better informed local decisions about how to deliver care and improve access and potentially where. Again, you can kind of scroll in and look closer on your own on this county level data here with this graph. Okay, so then the section we go to is some more specific insights. Here is where we compare Minnesota to a national average because without that context, the numbers don't mean much, right? So if you're a policymaker or a program leader, we might not understand if 17% is high or low or somewhere in between without that setting it with the national context. To really quickly help you see where Minnesota stands. You can also compare across states if that's helpful. Some states have similar challenges or demographics, and as someone working in Minnesota, you probably know which comparisons make the most sense for you. All 50 state profiles are available on the website if you want to explore them further and pull them up. There's also some easier ways to, in another dashboard, I'll show you some screenshots in just a moment to do a faster comparison across states. So earlier we talked about chronic disease, those high cost, high risk conditions like heart disease and diabetes that are closely connected to oral health. And because those connections came through so strongly in our research, we wanted to make it easy for you to highlight them when you're talking about decision makers or planning your own programs. So in this section, you'll find data on heart disease, diabetes, insurance status, and indenturism, all compared to those national figures. We also ranked each state across those 4 key outcomes, so you'll see where Minnesota falls compared to all 50 states. And just a heads up, it's small print here. When we're looking at these numbers, Number one was the worst, and 51, we included DC, is the best. So the higher, the better here, when we're looking at those numbers. If you're interested in really the technical side of the rankings and the data, that is all available on dentaldata.org. The full methodology is posted there. Okay. And that's the grade portion of the profiles. Really, we chose a report card format because, again, striving for this to be translational and a tool that was graphically appealing and easy for folks to take and use with lay people. Almost everyone has gotten a report card in their lives, and it's really easy to take a look and kind of understand that setting, which is why we chose that format. So we see the grades individually given for diabetes, rates of uninsured and dental visits, the percentage of veterans in Minnesota that visited dentists in the past year, and those then combined for an overall grade. And what I want to point out with this portion is encourage you not only look at the areas where there's a lower grade and an obvious column improvement, but look at the areas with a higher grade and success as well. Taking a look at where your state is succeeding and having those conversations with your coalition, with your partnerships, and exploring why and how you got there with that success story. Can really give us a lot of insight and potentially a path forward for the areas that need improvement. We can take the strategies that led to success in one area and potentially apply them to the next area. I also suggest that for other states, right? So if you have colleagues in other states and they're doing really well, that's a good way to connect and see what got them there. Part of the work that we do with these seminars is we do a full summary report of the community conversation that happens. And that is a living document on our website. And so you can go through and see the conversation and the resources and the programs that are happening in other states that have already had another seminar. Okay. So we talked about a quick dashboard. So if you want to pull up another state's profile, you can do so. This is just a screenshot of we have an interactive dashboard that gives you an opportunity to quickly gather comparable data. So here you could, this is not live, so it's not going to happen. It's just a screenshot, but you hover over a state and it pulls up some initial data so you can kind of quickly roll over and see, and then you might want to pull up that profile to dive in a little deeper. It's a fast way to get it done. Okay, that was a lot of data, a lot of me talking. So I want to pause for a second. And I'd like to hear from you in the chat. Is there a barrier that you see in your work that you know is there but isn't reflected in the data? We know data is limited, especially when we're working with publicly available data sets. And there might be things that you're seeing anecdotally or with your populations that is a real barrier for veterans in your community, but doesn't come through when we're looking at those data sets.
Sonia posted mental health in the chat, which I think is a great call out there.
Yes, thank you. Thank you, Shayla, and thank you, Sonia. That is very, very true and comes up in a lot of these conversations. We do a fair amount of work. We have work in our veteran research of that bidirectional relationship and impact on mental health. And we also know extends further into the clinical care piece of needing a trauma informed approach, needing to understand our patient population. So there's a lot of pieces there to talk through as a community. And if you see me looking over, I have my chat pulled up on my second screen, which is why I often just rely on Shayla. Okay. I would love for folks to keep popping in the chat barriers that they see in the work that they do with veteran populations that may not be reflected here. And as you do that, I'm going to go through more of your slides. So we talked about the data in the state profile, and we want to talk a little bit more about how we can use those. I hope what we covered was informative. But really, like I said at the top of this call, we want you to take away from this session next steps and how you can leverage these tools in your work. how you can use the data to illustrate the need, how you can share the profile to start community conversations, how you can take action and elevate success stories. Okay, and this is great. Thank you for continuing to share. Shortage of local providers, resources, workforce for sure. Housing, health literacy. Okay, this is really important. Thank you. Isolation, loneliness, and lack of community that convenes veterans to support them in practical ways. Food, housing, healthcare, employment, etc. Yes. Thank you, Lubov. Incredibly important. And again, we reflect these back in our summaries to pull this into the broader conversation of the pieces that affect veterans overall. So thank you for sharing. Okay. So again, diving into the how, we see this data, we understand that there's disparities, we have this tool, what can we do? One of the most powerful things we can do with data is to advocate. And that can look differently depending on your role. You might be a provider, you might be a clinician, you might be a policymaker, you might be a veteran yourself or a military connected family. We hope that this profile gives you credible local data to bring to, it could be your city council, it could be state legislators, it could be your coalition to start a work group around this issue area in your state. You could do something like organizing a listening session in your community. You could invite decision makers to hear veterans speak and invite veterans to speak for themselves. And really making a point here that small advocacy actions, things like calling an elected official, hosting a lunch and learn on this topic, submitting a public comment, they really can ripple outwards in big ways. Even just coming to this seminar and starting the awareness is incredibly important. Okay, educate to empower. So again, many people working in healthcare or veteran services don't know how stark the oral health gap is. And that's really kind of multi-piece here. Those pieces we cover. Many folks don't understand the eligibility that there is a lack of access. And I think this will ring true for all of you working in oral health care. Unfortunately, many people don't understand the oral systemic health connection and have that impact on the overall health outcomes, which we, again, seeing that chronic disease piece is so important. So as a result, you can use this profile to, again, do something like lead a short talk at your organization's staff meeting. Maybe you hold a lunch and learn. Maybe you hold an in-service, or it could be with your coalition or partner organization. Maybe your coalition, your oral health coalition, has partnerships with folks in housing or food or transportation. We are expanding our research this year, I said, on aging veterans. And so really some pieces we've started working with organizations like Meals on Wheels, those kind of overlapping organizations, and making sure that they understand the issue as well. We find that when stakeholders are informed, they become allies, and that's how we build momentum around an issue. And again, an opportunity to collaborate across silos, bringing in someone from housing, mental health, food access, and finding a way to align. Okay. The other piece is that we can inform strategic decisions. So data is a tool for strategic thinking. Whatever you might be doing, leading a nonprofit, managing a health program, maybe you're a policy advisor, the data can really help us be strategic. So you can use the profile to help you decide where to focus. So it might be an actual where, right? It could be one of those counties that has that very high population and a lack of access, whether it be provider shortages or a total lack of a clinic, or it might be an issue area where, like focusing on diabetes or insurance. The data really helps you make the case for why you're investing the resources where you are. So to that point, we really hope that this can help you fuel reports and grant applications and earn funding for those initiatives you might be pursuing, pull in resources. We know that grant makers and funders want to see data and they want to see it grounded in the community, and this profile gives you that. Again, we do this research to be tools to use, not to sit on a shelf, not to be behind a paywall. We want folks to be able to use this information And we hope that if you're applying for a grant, it could be helpful in your problem statement of your grant, showing the gaps in care and citing it. If you're measuring your outcomes and deliverables, it can be a benchmark for those measurements that you're doing in grant funded programming. Okay. We have a poll, but I want to pause because I think that there's some things in the chat, Shayla.
Yes.
Okay, I'm seeing Sonia. We have a large support
Mhm.
system for student veterans across the United States, which includes housing assistant, food banks, and childcare assistance. Okay, that's wonderful. Sonia, if you want to include any resources of how folks could share that out, or have that information, we're happy to, one, have it in the chat, but also share out and kind of post for the follow-up materials of folks who may not have been able to attend live. That would be wonderful. That's really great that there's kind of a full system of support there. Okay. Okay. So we are going to now do a poll. So thinking through the data that we covered and the tools that we do have and what we hope you can do with them, we want to be leveraging our tools and our research to best serve the work that you are doing. So we want to hear from you about what additional tools will be most helpful to your. We have a poll for that. And I will say that this is not just an exercise in asking you questions. This has informed the work that we're doing on veteran oral health. It has informed the additional research projects we have pursued. It has informed how we are updating the profiles this year. And it has informed some of the additional projects that we are doing, like some policy briefs, et cetera, based on how folks have answered these polls in the past. So they're very important. We take them very seriously. We want to hear from folks about what they need and what is helpful, and that shapes how the work that we pursue. Okay. Educational materials, research findings, training modules, policy briefs. Okay, we got some ties here. This is great. And I know I was seeing some folks in the I think in the chat as well posting health literacy as an issue there. So if folks want to talk about the educational materials, sometimes that's for patients themselves, for veterans themselves on a health literacy piece and oral health literacy. Sometimes it's from providers understanding the issues that their patients are facing. So if folks want to expand more on that in the chat, we would love to hear that as well. Okay. And we are going to go back to our slides. We'll leave that open. If you haven't responded, please go ahead and do so. So we talked at the top of this call about the fact that access to dental care through the VA is set at a federal level. So it's a federal advocacy issue. We understand as health advocates that can take a really long time to change. We are going to be working on it on Open Hill Day, which is really exciting. But that also means that we can be working mid and downstream at the state and local level at the same time when we try to solve that access issue. So we want to highlight a few states that have really kind of different and innovative approaches that they've done at the state legislative level to increase access. Florida is on here, and they passed legislation creating the Veterans Dental Care Grant Program within the Florida Department of Veterans Affairs. The program was designed to provide dental care to veterans in Florida, and the department partners with a statewide direct support organization to administer the program. The organization distributes grants to nonprofits who have a strong track record of serving veterans, and then those nonprofits deliver care to eligible veterans based on income, service history, other qualifying data. That was fairly new legislation. It was just implemented in 2025, so we've been keeping an eye on it. It seems like it has been successful thus far. So Florida is kind of a state and program to watch. It's an innovative approach and exciting to see it come together. Part of the thing that you will see here is that the states listed have very different geographies. They're in very different regions of the country, and they have very different political and legislative environments. And they have all accomplished something that works for them locally, which is part of why we're highlighting them. And we like to encourage folks to think through that you can think outside of the box, regardless of what your political environment might be. Oregon developed an innovative Medicaid carve-out specifically for veterans who don't qualify for VA dental benefits or traditional Medicaid. So veterans are first screened to determine if they qualify for either. And then if not, they're enrolled in a local coordinated care organization, and then they receive free dental care through a network of community clinics participating in the program. In Iowa, I'm going to talk about them a little bit more in depth in just a second because we've had the privilege of doing place-based work in Iowa for several years now, and they have a great track record, and we're really excited about what's going on in Iowa. Their state uses lottery dollars to fund the Veterans Trust Fund, and that fund provides direct grants to veterans to help cover out-of-pocket health expenses, to include dental care. So that's an innovative model. Colorado also has a trust fund for veterans, but it is administered very differently. So Colorado is another great state to take a look at and kind of explore what they're doing if you're in a position to be putting forward policy ideas and are looking at what other states are doing. Um, we highlight Iowa here again because we've had the privilege and the opportunity to do several years of place-based work with them. We like to show it as an example of what a state can accomplish if they're really committed and activated on the issue of veteran oral health. So we were able to do a very comprehensive 70 some odd page, year-long research project, and produce a report, a needs assessment report in Iowa. From there, we took the findings and the strategic recommendations out into community forums and community discussions, which culminated in an in-person summit on veteran oral health. The work there and the selection and the culling down of the strategic recommendations that were in the report led to a strategic plan, a roadmap for their coalition to follow. Having that roadmap allowed their coalition to put together a working group on veteran oral health. And that working group just came together at the very end of 2025. They have already met with the veteran commissioner. They are working on rule changes to the trust fund to make those grants that I talked about more accessible. They have done leaps and bounds of work in a very short amount of time because of the pre-work that was done and the data that informed the community voice that came up around the issue. So it's really exciting. We have a lot more information. If you're interested in kind of the model and the work that was done in Iowa, we're happy to answer questions. All of our reports with the work that we've done with them are available on our website. Okay, so
Liz,
yeah,
perfect timing actually for discussion. We just had a few Iowa questions. Sonia had asked how long has the dental program been in Iowa? And Sonia, you may want to clarify that. I'm assuming you mean the work that AIDPH has been doing there, or was it another program?
Yeah, so just curiously, I was an iSmile coordinator for about 7 years in Iowa for Bob Russell. And so I was in the Cedar Rapids area, was my part of the state. I did a lot of stand downs and things like that to help with veterans, right? And I'm just when you said Iowa and positive for oral health, that just blew me back because a lot of our programs that we have there are now gone. And so it almost brings tears to my eyes that you actually have my program on that slide because that was the greatest job in the world. I teach now, which is probably about bar, but that I'm extremely proud of that. And I'm glad that everybody else gets to see that because nobody really knows what that is up here except maybe Nancy. And so if you guys figured out a way to get the Iowa Lottery to help those veterans, I'm so grateful that you're able to do that. And I'm happy I'm here today to see it. So it must have been, I've been up here teaching for about 3 years and step back from that role to finish my master's. So when did they start delving that money up from the lottery, which is super smart because there's a lot of them actually sometimes at those casinos, to be honest. And so what a good way to be able to give back to the people that deserve it the most. So thank you for that. And that's just kind of what I wanted to say. I'm just so stunned that you have that on there. So thank you very much.
yeah, thank you. As smile coordinators, we work with a lot of them through community work, and I'm not sure if I highlighted it enough, but really the way that we approach that work is going to the community and really just serving as a facilitator to help them have a conversation around the data that we found. It was a advisory committee that looked at those strategic recommendations and put together the strategic plan and the roadmap and what issues to approach first. And some of them were those trust fund issues. The trust fund is amazing, but we can always improve, right? So there's some things that were put in place. For fraud prevention, which makes a lot of logical sense when you see it on paper. But as we know, as folks working in the public sector, sometimes things make sense on paper, but in practice, they create more barriers. And so that's some of the pieces that they're approaching now is some of the rule changes around needing 2 referrals and 2 care plans to get those dental care grants. But the iSmile coordinators, congratulations on your work, Sonia. They are a delight and a pleasure, and some of the most dedicated professionals that we've had the pleasure of working with. They're just wonderful and clearly so committed to their work. So that's been a highlight for us to be able to work with them. And
Steph
also,
Chickering, do you work with Stephanie Chickering? Stephanie Chickering?
not
She's
specifically,
not there
no.
maybe anymore. She's my little sister in dental hygiene school too, which is kind of funny.
Yeah.
But yeah, that's a want-to job. And
You-
the daily joy that you get out of helping families and children within an immediate help, or at least a step to where they need to go. I mean, I've been in dentistry for 32 years, and being able to, see that you're moving forward with what we started at, like our kind of our framework, just very moving. And I'm grateful that I still have a lot of colleagues down there that are doing that. So thank you for that update, because I don't hear much about it being up here teaching anymore. I'm kind of in my own world, right? So thank
yeah. Yeah, we fully support the iSmile coordinators and hope that there are more and they are expanded for sure. What other questions can I answer for folks?
I have a question, but if someone else has something, I'd rather they go before me. Um,
You can go ahead.
okay. So so we're at a C as a state, that's our grade. And the 3 states that you showed us that were doing something creative, those included funding. Do you have any examples of things that states have done that didn't include funding care? I think it's great. I'm not knocking that. But um, prevention or an education or something that maybe the coalition um, could spearhead or could be a part of that would help us get, raise our grade.
That's a really good question. I get a little caught because I think that sometimes, even if there are things like prevention, to me, as a public health program specialist, I think we need funding for everything, right?
Yeah, but do you know what I'm talking about though?
Do you mean like legislative, like
No,
government funding?
aside from funding more care, I'm just making this up. Have you had states that have a better grade than us because they did comprehensive um, flossing and brushing um,
So is
events or something, or they gave away toothbrushes? I'm just making up something on the fly. Something that people can do that doesn't require or that isn't a part of funding more care. Does that make sense?
yes. I think that there are states out there doing those programs. I don't know if we have the granular data on if that is moving the needle and
Yeah.
like the causal piece. I think something that we can look into again, Jill. I think we could probably do a scan of
Yeah, and
different summaries and look through for those pieces. The states that come to mind, other states that have started conversations after these type of pieces, everything that is popping into my head is legislative kind
okay.
of coalition pieces.
And,
That
and I
doesn't mean
love
there aren't
that.
other examples. It's just what is coming to mind
Yeah.
first.
Yeah, that would be interesting. And I'm on the board of ANOC, so we have an American Network of Oral Health Coalitions for anybody that doesn't know it. So it'd be a good topic for us to look at. Are there states that, I think of programming type of things that we could do. But yeah, thank you. I was
Yeah,
just
we work with Tanya a lot, and I mentioned that we do a lot of work in the disability community,
Yeah.
access and care for people with IDD, and we reference Kansas Oral Health, um, oh gosh, their passport, right? That's the term that they use, their Care Navigator passport for people with disability. And that's an amazing program that is
Okay.
open access that Kansas has it posted. It's for a different community, but I'm thinking through of like the mental health pieces and those
Sure.
conversations. Um, and that could be a really wonderful resource for the education, the health literacy,
Yeah.
the clinician education. It could be a model that I think could be easily translated. Lubov, I'm looking at you because there's so much of the work that you do. Um, I'll just send out project ideas for all of you to get started working on.
And I love that idea of taking what works in another topic area or another issue area and putting it on ours. So that's a really good idea, and I can look at Canvas.
Yeah, yeah. Do folks have other questions? Okay. I can go back to our slides and I'll give us some closeout calls to action, some um, housekeeping logistics for all of you who may be looking for CEU today. And I will also just double tap. I know that there were some links in the chat and some resources shared. If you are someone who is conducting a program or doing work and you want your colleagues to know, please pop in the chat. It's the folks here, but Shayla does, again, a summary report that goes out, and she also does a summary email out to all of the registrants who might not have been able to come live, and we encourage folks to share. So it goes out to a broader group as well to continue that conversation. So please feel free to share if there are things you want to highlight.
Great.
And sometimes I lose my slides when I take them down. So just give me 1 second here. I found them. Okay. So again, I hope you're all feeling activated. I think maybe that was reflected in some of your questions. It's a lot of information to take in. We're all very busy, especially this time of year for everyone. So I'm going to leave you with one concrete, very easy step to take after this session to keep the momentum that I hope that we built here today. And that is to share the state profile with one new person or organization. If you are willing, I would love it if you post that in the chat of who you're going to share it with. We would love that. It helps us keep each other accountable, helps keep each other engaged and encouraged. And just think through one person or organization that you think could be activated by this profile. We also want to highlight a unique opportunity from AIDPH, and that's our Veteran Oral Health Strategy Lab. This program offers free technical assistance and capacity building support to organizations working to improve oral health for veterans. So if you are an organization that is working on an issue, we have funding to provide free technical assistance to small organizations doing that work. So please reach out. I think Shayla's going to pop a link in the chat. That's an interest form. You can just fill it out, set up a call with us. We can chat through what the options are. It's, you know, again, it's free, there's no fees, there's no commitment. So I encourage any of you who that sparks an interest in to fill out the form, or if you have colleagues or organizations you know are doing the work, please share that out. Okay. And this is just a little bit more of what the strategy is. It's designed for organizations, again, working in veteran oral health. It can be community-based organizations, nonprofits, health systems, state and local departments, advocacy organizations, other partners advancing access. It's really pretty open. So if this at all sparks an interest, please reach out and let us know. We would love to help get that service to folks. Okay. We also just want to highlight that AIDPH has applications open for our FSI program. It's our Federal Service Immersion Program. This is a week-long intensive program where we bring a cohort of folks to Washington, D.C. for a week. We meet with federal health agencies. We meet with nonprofits and NGOs and other organizations in the D.C. area. We do advocacy training, and we have a Hill Day and a debrief from our Hill Day of how to stay activated at the state and local level. And veteran oral health is one of the issue areas that we will focus on, that we focus on the last 7 years, and that we will carry over into that Hill Day that we do as part of the curriculum. So So if that is of interest to you and getting activated in DC and the federal landscape is interesting, or you know someone who is interested, Shayla's popping that application link in there as well. We shared out about the state summary report several times. That's a resource that is helpful to see what other states are doing, and your summary report will go there as well that you can share out with colleagues. CEUs are available for today's session. Those are hosted on our academy. They can be located via the link in the chat. You set up your username and your password, and you navigate to your state seminar and request your CEU. There is also an evaluation tied to that CEU request. So if you are not interested in CEU, but you would like to share thoughts and feedback and upgrades, we love to hear those about our programming. We want to be of service and for these to be the best opportunity for you. So if you would like to just share your evaluation thoughts, you can do that as well. Again, we are posting our recordings and our resources from today's session. We also do veteran oral health storytelling, gathering stories so we can raise the voice of veterans, lead from behind. And we have a storytelling forum. So if you yourself are a veteran that has an oral health story to share, or you know someone who is a veteran with an oral health story to share, please take a moment. It is anonymous. You can record your story and we can pull that into our advocacy initiatives. We are exactly on time, so we leave you with Veterans Deserve Equitable Oral Health. And thank you again for being here, for engaging in discussion, for activating on this topic, and taking time with us today. You'll see us in email with follow-up. And if there are any questions about resources, please reach out. Take care, everyone.
Thank you so much.
Thank you, Nancy.
Yeah,
Take
thank
care.
you. You too. Thanks everybody that could make it.